myself Dr. Kirti, Assistant Professor, Physiotherapy Department. So today we'll discuss about the various components of blood. So blood is a connective tissue and it is the most important fluid of life basically because it carries the oxygen from the lungs to the different tissues of the body and carbon dioxide back to the lungs. There are some properties of blood like its color is red, like basically scarlet red, and in arterial and as venous blood it is purple red. Average volume is 5 to 6 liters, and in females it is 4.5 to 5 liters. The reaction in pH, it is slightly alkaline in nature, having pH 7.4 or 7.45. Viscosity, it is 5 times more viscous than water. So we are having some different functions of blood, like it is having the nutritive function, respiratory function, excretory function, transport of hormones, enzymes, regulation of water balance, acid base balance, body temperature regulation, storage function, and defensive function. Next, we are having the composition of blood. So plasma. So basically, it is a straw-colored clear liquid having 92% water and 8 to 9% of the solid substances. So basically, the solid substances are inorganic and organic substances, and 55% of the blood volume. We are having three plasma proteins: albumin, fibrinogen, and globulin. And albumin are further also divided into alpha, beta, and gamma globulin, and the values are also they're written. Functions of plasma protein: it helps in blood coagulation, defense mechanism, transport mechanism, maintenance of osmotic pressure, blood viscosity, and acid base balance regulation. So this is the chart in which the composition of blood is explained, like the whole blood is divided into plasma and formed elements. So plasma includes some organic and inorganic substances like amino acids, nitrogenous weights, nutrient, electrolytes, protein, gases. Protein are further divided as discussed before. And there are some also formed elements like blood cells. We are having RBCs, WBCs, and platelets. So further, WBCs are divided into granulocytes and agranulocytes. So granulocytes are neutrophils, eosinophils, and basophils, and agranulocytes are lymphocytes and monocytes. So the further blood cells are divided into RBC or erythrocytes, WBC or leukocytes, and platelet or thrombocytes. So there is also a serum which is similar to plasma, but only the difference between the serum and plasma is only of the presence or absence of a clotting factor. So serum is plasma and without any clotting factor, that is fibrinogen, and it is also a clear fluid that oozes out from the blood clot. So RBCs are biconcave disc, non-nucleated. It transports hemoglobin, and their mean diameter, thickness, and average number is written. And production in early embryonic life in the yolk sac and in middle trimester in the liver, and from last trimester to after birth in the bone marrow. So usually the lifespan is 120 days and it is destroyed in spleen. So there are some pathological variations like anemia and polycythemia. So this is how the normal production of RBCs and their different characteristics in different type of anemia. Like first of all, proerythroblast, from that phase of erythroblast, then polychromatophil, and then orthochromatophil estrus, and then reticulocyte, and finally erythrocytes are formed. So in different anemias, like in microcytic hypochromic anemia, second is the sickle cell anemia, then we have megaloblastic and erythroplastosis fetalis, which is a condition usually occur in the second child of a female having the negative blood, if usually the precautions are not taken at the time of the while first delivery. So stages of erythroblast we have discussed. So there are some important events like during the first stage, their synthesis of hemoglobin start, then nucleoli disappear, then HB starts appearing, then nucleus disappear, then reticulum is formed, and then cell enter the capillary. from site of production. Then reticulum distal cell attain the biconcavity. So next we have regulation of RBC production. So first of all, tissue oxygenation. Any condition can reduce the quantity of oxygen transported to tissue, like anemia, high altitudes, tissue hypoxia, or damage to bone marrow. And erythropoietin is a substance which stimulates and its formation increase in response to hypoxia. There is also the B12 and folic acid, which is important for the final maturation of the RBC. So B12 and folic acid are also important. So someone having anemia, usually the B12 or folic acid supplement is usually given because they are required for the maturation. Formation of hemoglobin now. So synthesis begin at proerythroblast and continue to reticulocyte stage, and each heme molecule combined with long polypeptide chain globin to form hemoglobin chain. So usually 4 HB hemoglobin chain form 1 HB molecule, and 4 oxygen molecule loosely bind with 4 iron atoms. So average hemoglobin content is 14 to 16 gram per deciliter. In males it is 15 gram per deciliter, in females it is 14.5 gram per deciliter. Next, we are having the WBCs, and these are the mobile unit of body protect mechanism formed in the bone marrow and in the lymph tissue, stored in bone marrow until the need arises. And lifespan is usually granulocytes are having 4 to 5 hours in circulating blood, or another 4 or 5 days in tissue where needed. The lymphocytes they enter the circulation through lymph nodes and wake for months. So monocytes are usually in blood for 10 to 20 hours. So in this way, the WBCs are formed like myelocytes and then lymphocytes. So this the whole process is. So the different cells of myelocyte series like myeloblast, then promyelocyte, megakaryocyte, the neutrophil, then young neutrophil, then band neutrophil, then polymorphonuclear neutrophil PMNs, that is xenophil, then eosinophil, metamyelocyte, then polymorphonuclear eosinophil, then basophil. So this is how the stages and final stage of monocyte formation, 16 stages. So these are the normal values of different WBCs like neutrophils, xenophil, basophil, monocytes, and lymphocytes are shown in this table. Then functions. So usually neutrophils are mature cells which attack, destroy the bacteria in blood. Monocytes are immature cells in blood. They enter tissue, expand in size. They are macrophages, and they also capable of combating the intra-tissue disease. Phagocytosis, cellular ingestion of offending agents. Xenophils, they are weak phagocytes, and they are more parasitic, produce more in parasitic infections. Basophils, they release heparin with mast cells, and lymphocytes are required in the acquired immunity. Last, we are having the platelets. So usually they are colorless, non-nucleated, formed in bone marrow, and half-life in blood, like that is 8 to 12 days. Then they are eliminated and in the spleen. Then they help in blood clotting, prevention of blood loss, clot retraction, and the repair and the defense mechanism. Thank you.